Hello, everyone. Good afternoon. Hello, Alicia. Um, so glad to be
Hello.
here.
Very glad to be here. It's nice to have a follow-up to our last Facebook Live when we talked about allergies.
We get so excited, you guys, about being here. I usually prepare a little bit the day before just to go through the submissions and live cases that we've received, and I'm very grateful to all the dog lovers who submitted their applications. I'm really sorry that I can't really help everyone at this point, but if you applied and if you have any questions, our customer service team members and I will be replying to all the questions that you have. And it's been a real pleasure to do these. I really love to connect with you. I also know that there is much need for help and maybe a little different point of view at different problems. And one of them definitely are allergies. We have 4 cases, each 15 minutes roughly. We may be going a little bit over an hour, just including questions, but we can start. So let's get
Started. Yeah.
First doggy on board.
Our first dog lover is Kathleen, and she will be joining us momentarily. I've just admitted her to our Zoom room. And Kathleen is joining us to discuss her beloved pup, Piper. Hi, Kathleen.
Great.
Hello,
hi, Kathleen.
How are you?
Good.
so glad to have you here. Hello.
Hi, doctor. Nice seeing you.
Oh my goodness. If you don't mind, just move your screen a little down so we can see, because I sometimes do that too when I want to peek from behind.
Is that better?
That's perfect. So Kathleen, we have 15 minutes for each doggy, and just to make it a little more efficient, I'm just going to read through what you've given us, and then I'm going to give you some suggestions, and then we'll be able to answer some. Then you'll be able to ask questions, and I'll be able to answer them. So we'll just and is Piper nearby or?
Yes. Come here, baby. Come.
I think that everyone would like to see Piper.
Here's Piper. She just woke up from her nap.
It makes me so happy to actually see the real dogs and real faces. Just knowing how much everyone loves their dogs. I can see that he and Piper are like this, right?
Yes, we are.
Oh my goodness. So. Everyone else, thank you so much. We'll be also answering questions in the background about within the comments that you post. And Piper is 3.5 years, so she's a young chicken or young doggy. And Kathleen, just correct me if there's anything that I do not say correctly, but I understand that she's had some problems with skin allergies, and she's been diagnosed with so-called atopic dermatitis. She's had some challenges in the past as well. She was bitten by a deer tick, and she had anaplasmosis, which used to be called ehrlichiosis, which is a blood parasite. And then she started to scratch in March 2020, and I understand that she was in an accident with you. Is that right?
Yes, on Christmas Day 2019.
Oh,
she wasn't
goodness.
in her car seat at that time. I was driving my daughter's car instead of my own. So
things happen, and you never know.
I know.
If she was in a seatbelt, maybe things would be the same. So everyone, the interesting part about Piper here is that that she started scratching not very long after the accident. And I often say that scratching may be a sign of allergies, but it also may be a sign that there's something going on in the neck or back of the patient, or in this case, Piper. And often these cases are not addressed the best way, because people generally assume, and some of my colleagues assume, that when a dog is scratching, that there are allergies, and that is not always true. Now, Piper, and correct me, Kathleen, if I'm wrong, Piper has been on prednisone and antibiotics. He's been also on Atopica, which is sorry, he hasn't been on Atopica. That's a mistake of mine. He's been on some other medication. She's been bathed in chlorhexidine shampoo as well,
Yes, once a
and
week.
you've been trying your best. I can see, like you've been dealing with this for almost a year, right, or over a year now.
Yeah, just about, yeah, a year started beginning of March last year. And we haven't hit our full spring pollen season, but she has started been, dragging her behind and licking her
Okay,
paws again and scratching
okay.
her face, shaking her
So
head.
that is interesting. So do you think so? So it starts seasonally. Does anything change like in spring? Like does she do what kind of activity or what kind of lifestyle does she live? Does she go out
Uh,
more in
Piper
spring and summer?
walks, no, all year long. She goes for 3 walks a day. Um,
Okay.
Before she started with this in last March, we could walk at least 3, 4 miles easily and no problem, 5 miles. And now it's just like she does her duty and she walks a little bit, but most days she
Mm,
doesn't want to walk long. And we have a large tennis court that she would run and play for half an hour. Now she does about 3 or 4 runs to get the ball and then
mm.
she's done now.
So you can kind of see that her energy, and she's 3.5 years old. Like she's a young dog, so she should not be
Yes,
acting like that.
no,
So
she's. I call her my little old lady, and she shouldn't be.
yeah. So so you're worried. Any testing has been done? Like you've done tests and blood tests and parasite tests and all that stuff, right?
Yes, they did all
Okay,
that, and the next thing would be immune therapy if we go in that direction.
I understand. So, Kathleen, I made some notes yesterday, and I'm going to go back to my notes here to make sure that I don't forget any of them. So, she has still been on prednisone, correct?
Yeah, she's been basically on it straight, doctor, since August, and that's way
Since
too long for
August.
my liking.
Okay, yeah. Has she been drinking excessively, or do you see some signs of beside her slowing
Always,
down and having?
she's always drinking now. Even in the
Okay,
middle of the night, she wakes up at least 3 times. I make sure she has water during the night. At least 3 times a
yeah.
night, she wakes up to drink.
So one of the side effects of prednisone is that they drink a lot, and obviously, if prednisone, which is a corticosteroid, is given on ongoing basis, then it affects the whole hormonal system. It suppresses the immune system. Dogs usually drink more. They gain weight. They may have a little bit of pot-bellied appearance as a result of the medication. So our goal will be to, I will try to, and again, this is just for educational purposes, but you're a free person, you can do whatever you wish.
Mhm.
Just a disclaimer. I will try to kind of give you an idea what I would do if Piper was living with me and had this particular situation. I know how do you feel about the whole situation? It's worrisome,
I
isn't it?
I feel like they're just giving her drugs for band-aids. And I know allergies is a long life issue, just like when you said you had it last week, watching what you ate and things like that. And I realized that. But I feel like they're just giving her drugs just to basically quiet both of us up. And I don't want
Hmm.
that for Piper.
Hmm.
And actually, they had us stop with all her supplements that I was giving her also. So Piper hasn't had her supplements really since August either.
Yes,
So
yes.
they don't
And
believe in all that, and I want to get away from that.
yeah, and so you worry. What is the biggest worry? If you could just summarize into what do you worry the most about? Like some people worry about one thing, and another person worries about something else. It's very individual. What is the biggest worry of yours in
Piper
this?
being discomfort because of her swollen paws and itchiness.
I
So
see.
her being very uncomfortable, that really worries me,
Okay.
and the long term effect of the drugs.
Is it okay if I share some of the photos that you sent me, just for everyone else to see? Because it's again, this is important for us to share with everyone else. Let me just, I have one. Oh, sorry, I will have to really quickly go to the to the other folder. I just realized I um I didn't save them all. Just a moment, everyone. Alicia, in the meantime, if you have anything to add or anything to mention while I'm searching, that would be wonderful.
Yeah,
You're always so
absolutely.
good.
While Dr. Tobias is
Rescuing me.
looking for the photos of Piper, sweet little Piper, a reminder to everyone in the community that's watching, if you didn't catch Facebook Live 2 weeks ago, we did a big presentation on allergies. So I strongly encourage you to go back and check that out. We'll make sure that we post the link in the comments below. And in the meantime, stay tuned. We've got 4 people with 4 amazing dogs, and I hope that the information discussed will be helpful for everyone that's listening and watching.
I am looking for these pictures, and it looks like my computer has not added them on. Alicia, is there any chance that you could share some of them? Especially the neck
2.
and you have
the
2.
ones, yeah, the ones we have of Piper, I will pull them up. Should just take
Maybe that's all
here.
I have. So there's
it's
I have
the paw.
feet and then I have her in a little bed.
In the bed,
I'll
that's
share,
right. Yeah.
I'll share with everyone. Okay. I have the feet here. Does she lick her feet?
Very much so.
Kathleen?
Yes,
Okay.
doctor.
Okay. And how long are her nails?
Right now, very short, because she was just groomed last week.
Okay. And is she licking anywhere else, or is it just the feet?
She tried to lick her vulva area.
Okay. Okay. When you massage her or when you touch her back or neck, is she sensitive in any areas?
No, actually, every morning when she wakes up, I like do a massage down her back and her neck, and she does like the stretch and stuff. Every morning she does that.
Okay.
So.
And are there any signs of her scratching when you go along the back? Is she scratching in certain area more, like her hind leg is going?
No.
Notice? No. Okay. Okay. And are there any other skin lesions anywhere else? The other picture is quite dark. So
her teal, I can try to. I don't know if I'm doing a good job, but
you're doing an awesome job.
You see where she drags right here?
Okay. And has she had her anal glands checked recently?
No.
No. Okay. Okay. So I'll try to give you. So I'll give you a real quick summary of what I'd do if she was my dog. Now, if a dog is in an accident and the changes and the scratching start very quickly after, or not quickly, but within a few months after, I was in a few accidents, and I know that the injuries can linger for months and sometimes even years. If she was in an accident, if you were, I think that someone ran a red light, right?
Yes.
Yeah, so you were lucky, but obviously that is a big impact. And she was probably thrown. You said that she ended up in the front seat beside you suddenly.
Yeah, correct? I don't really remember because I was kind of knocked out. So I just remember her sitting next to me when I came. So
usually what happens in these accidents, the neck gets jammed, or some portion of the spine gets really jarred, and there can be some sort of misalignment. So the first thing that I need you to do is to find someone in your area, if it's possible, who can check her neck. And it can be, it can be just the upper cervical vertebra if she got jammed like this, like if she hit with her head, or the whole spine can be affected. And if you're massaging her, it may not be obvious to you, but an experienced chiropractor, physical therapist, or acupuncturist would possibly see that there are some changes and that there is muscle tightness. Does she wear a harness, or does she wear a collar when you walk around?
Harness. She's always worn a harness.
And do you have a retractable leash, or do you have a regular leash?
No, a regular leash.
You're amazing. All these things that you're doing right. So the first thing that I'd like to do is to find a chiropractor or someone who is able to give you a hand with assessing the spine.
Okay.
Do you have anyone like that in your area, you think?
Actually, I started doing a little research of that, and there's one about an hour away that is a
Okay.
chiropractor.
Okay, wonderful. Look up the reviews. So usually they're correct if there are more than 5 or 10,
Okay.
and book an appointment. So that's the first thing. The paw licking often happens when there's something going on with the lower cervical spine, and the hind end and around the tail. That's actually slightly different. So let's assume that most likely she's got a neck injury from the car accident, which is actually the most common one that happens anyway. Second, her bum licking and scooting may be related to anal gland issues, like especially dogs that they're on prednisone, they may have compromised liver. The liver connects with the anal glands, and sometimes the anal glands just don't empty. The tone of the glands is not as good as it should be. The bowel movements are not firm enough for the anal glands to be massaged, because they're roughly about let's see, 4 and 8 o'clock around the little poop chute. Okay, so that's where they're located. And I sometimes recommend giving. Are you feeding cooked food or
Cooked
kibble? I
food.
forgot. Cooked
Cooked
food.
food. Hmm.
It would be nice if you could dare to feed her a little bit of maybe chicken wings or something like that, because the bowel movements will become harder, firmer, and then the anal glands get massaged by the firm poop. The other thing that I would recommend is to either see a groomer or your veterinarian who can express the anal glands, but the veterinarian will probably be able to assess them. Sometimes they get full. If there is only the paw licking in the front and the back, around the rear end, I would say check the anal glands. And with anal glands and the medication, and knowing that the medication affects the liver/anal glands, we may want to do a little bit of a liver cleanse, LiverTune. So that's something that we will do as well. It's a herbal formula. We've been using it now for about 1.5 years since it came out. And it has really proven to be beneficial, even for the anal gland health. Obviously, nutrition, the essential supplements. I do recommend the Fabulous Four because I trust them and I formulated them. But
Yeah.
if you don't, then you can do something else. Make sure that you do use fermented supplements as opposed to the chemically made synthetic ones. Um,
So,
Now, the most difficult part, and this is the toughest one, is how to get her off the prednisone. Um, I know that there were no dogs who would die of itching, okay? But I know that if we keep her on the medication for a long time, that it's going to shorten her lifespan and cause some other problems. She may already start, she already has some sort of start of Cushing's disease-like symptoms induced by the medication, which is increased drinking. We really want to get her off the meds as soon as possible. The thing is that you have to kind of reprogram your mind a little bit. I know that you worry about her comfort level, but most dogs do fairly well when we actually are not as worried. What I would do if she was my dog, I would gradually start tapering the medication down. And again, you may talk to your veterinarian. This is for educational purposes only. What I would do, I would start giving it every other day, then every third day, then maybe every once a week only. And I would make the transition within a period of 1.5 months or so. In the meantime, you may want to increase the omega orals to twice the normal dose, just because they're anti-inflammatory. And if she's licking her paws, and dogs do really well with this. There are these inflatable donuts, and Pax had it when he got neutered. And I was worried about him. I was thinking he's not going to handle it well. He was just fine. He would use it as a pillow. And if Piper is scratching around the body, then you may want to even put a t-shirt on so she doesn't damage the skin. But there's a period, it's almost like, it's unfortunate, but the body becomes a little bit of a junkie when it comes to the prednisone. It doesn't really like to be withdrawn. And so you will have to gradually, over the 1.5 months, to slow it down. And if the paw licking, it's not the end of the world. And I know that you've been told that there may be some maybe yeast, right, or something like that going on.
Yeah, some
Um,
yeast.
this is the thing. The feet are part of the whole body, obviously. Big surprise. But it's part of the energetic system. And when the energy from the neck is blocked, and I'm quite certain that it is based on the symptoms that you're described, the skin and the muscles and the whole part that is supplied by that area is compromised. And yeast normally sits on the skin and it does nothing. But when there's compromise or when a dog starts licking on a regular basis, then the yeast have better environment to grow. I personally do not worry about that usually, unless there's some sort of very severe infection with bacteria and pustules and all that. If you stop her licking, I think that she and protect her or prevent her from licking by using the collar, I think that she will really be okay and comfortable. If you really see that the feet are red, you can actually use skin spray, which is the herbal formula that I use for wounds and skin and all that. But I think that if you prevent her from licking, it'll be maybe the next 2 to 3 months where you will have to really be patient with her and remind yourself, this is not fatal. This is not something that she's going to die of. I have to take her off the meds because that's the serious stuff. Okay.
Right.
And I know that our anxiety, when we see our dog scratching, it's aggravating, it's annoying, it's worrisome. I totally understand. So be nice to yourself. When you start worrying, what I usually do, I say, okay, where do I feel the worry? I locate it. Sometimes it can be in my tummy or solar plexus or in the heart. Then you feel the feeling, the sensation, and imagine that it is a volume, and you turn the volume up and it'll disappear. You close your eyes and you feel it, and you try to feel it more intensely, it disappears. You may need to do it 10 times a day, maybe 20 times a day, maybe once a day, but it really does help. But the most important part is to check her neck, check her anal glands, take her off the prednisone gradually. And you're a free person again. I can really give you direct instructions, but you can either talk to your vet or you can just decide, okay, I'm going to taper her slowly down. If your vet is a reasonable, sensible person, I believe they are, then they will not be opposed to it. I do not really think that you're dealing with allergies, and it's going to be a little bit of a challenge for you to either take it as given or talk to your veterinarian and say, I'd like to go this route because it makes a lot of sense. I know that everyone or most people in the veterinary industry and most veterinarians really do care, and there is no doubt that your vet cares. It is just a slightly different way of seeing things. And I was in the same situation where I would see a lot of dogs not really responding to the treatment. That's why I started to look elsewhere. And that's why I realized that most dogs that lick their feet are actually not allergic, even though it may be seasonal. Like there are other things that, I think that the body is a very sensitive system. And once we start tinkering with the immune system, like giving the prednisone and there is neck misalignment, which is super important for the whole health of the body, other things may come up and there may be some seasonal changes, right? But I do not think that the primary problem are allergies. You're feeding the right food. I believe that you're giving the essentials. You may do the liver cleanse. Make sure that you do give probiotics because 80% of the immune system is in the gut. But overall, I think that this should be simpler than it is and less difficult to deal with. The challenge now we have is that we are on the prednisone. And as I said, the body gets used to it. And it'll be a long
time.
Stay in touch with us. Stay in touch with Alicia.
Okay.
Let me know how things are going. But the most important part is to find a good chiropractor or physical therapist or someone who will be able to address the neck.
Okay. And if Piper was your dog, you would go chiropractor over acupuncture right for the first.
I have a lovely chiropractor. I would go chiropractics first with gentle, most of them do actually very gentle adjustments. Physical therapist, acupuncture, You know, you may also need to try, right? One practitioner, what I've seen, one practitioner may not give me the results that I need, and another one does. So it's a little bit of a search. And I can see that you love Piper very much, and that she's in the right hands. And I know that you're doing your best. So
Okay.
don't beat yourself up for this, because this is not your fault. But I also would consider, if you had an insurance claim on all this, you may want to actually ask for some sort of reimbursement for your veterinary expenses, because I think that would be only fair. You know, accidents happen. It's not, it's a mistake that someone else made. But I do not think that you should be actually paying for the mistake of other people. So especially in Piper
that's
already,
good. Yeah.
yeah. So any other questions before I will have to go?
So you don't think I should go with allergy testing, immune therapy? I should go, if Piper was your dog, I should go chiropractor first and get her
If
off
Piper was
prednisone.
my dog, I would, I think I have a strong belief that if you test any dog, healthy dog or not, it would actually be interesting if if I tested Pax, whether he would be allergic to something. I think everyone is allergic to something according to tests, but it's not like you can put your dog in a plastic bag and make it totally sealed from the outside environment, or start restricting food to the point where you just give hydrolyzed food and nothing else. It's not
Yeah,
life, and
no,
it's not real food. So
no.
I usually I'm not really keen on the allergy testing. It's it may be beneficial in some cases. I wouldn't take that direction. You asked me, I'm giving you an honest answer. I mean,
That's good, doctor. I've been putting it off also.
you
'Cause
can
I
do it for
just,
your curiosity, but I think that
in
it
my
would not be
gut,
my
it was just
choice.
telling me it was from the accident because she was such a healthy, happy, active dog before Christmas Day. So that's
Yeah.
why I was just,
Oh, well,
so
this
I'm
is
going
a
to go
learning
that route.
lesson. This is a learning lesson. Just go what makes sense.
Okay.
Obviously, you're not obligated to follow any of the information that I've given you. And as I said, it's for educational purposes only, for everyone else
Thank you for
as well.
enlightening me, doctor.
Thank
I
you. Thank you for
very much
enlightening me.
appreciate
It's a
it.
pleasure. Take care.
You
Bye-bye.
take care.
Ah, nice. Alicia, you're navigating through the maze of
Indeed, yes.
waiting
So,
room.
yeah.
Okay.
Next, we're bringing on Zamyla, and she will be chatting to you about her little girl. Her pup is Mila, and you have quite a few photos of Maiyu. Sorry, I think in
Mayu.
Dropbox. Maiyu,
Yes.
yes. There's
Yes.
Maiyu. Hi, Zamyla.
Hello.
Hi, Zamyla. Hi. How
Hi.
are you?
Good, thanks. Thanks for having us.
Oh, thank you. I'm so glad. I'm not sure whether you recognize it. I have such good time with connecting with you and everyone else. It's really fun. And Mayu is how old is Mayu?
She's around 8 years old.
She's 8 years old. And you've had her since she was a puppy?
No, no, she was a rescue from Boston, and so I've
I
had
see.
her for about 3 years.
Mhm. Did she have the problems when you got her?
She did, yes,
She
yes.
did. Okay.
You mentioned
And
that she had
I
just,
see.
yeah.
And do you know any medical history like before you got her? Like was she on any medication or did she have any diagnostics or any tests or anything?
Unfortunately not, no information.
Okay, okay. So if it's okay, I'm just going to share with everyone else just a brief summary of Mayu's history, just for efficiency. I know that we could talk for a couple of hours, but we only have 15 minutes. So I understand that you've been told to put her on limited ingredient kibble, and you're also feeding some natural cooked diet and raw bones for the last year. And the medical history, supplements, she's getting acidophilus. Medical history, she has a dry eye condition, which is called keratoconjunctivitis sicca in Latin, but dry eye is clear for everyone. Lack of tear production as a result of some sort of immune destruction of the tear glands. And that's what happens in some dogs. And she's also using antifungal shampoos, correct?
Correct, yes.
And I know that she's getting about 10% of her food as dried liver treats, freshly baked or boiled. And she's also getting salmon once a week and sardines. And I can see that you care. Like, every time I look at the file, I know when I'm facing someone who's really caring, and I know that you're doing your best. Now, her tear production has been lower in the last test, I believe, correct?
Yes, yes.
For everyone else, tear test is kind of an interesting test. I'll show you how it's done. I have a little picture here. And obviously, Zamyla, you've seen that, but other people haven't. So I'm just going to. So you put a little, really little piece of toilet paper in the eye. Actually, not toilet paper, but a little piece of paper. And there's a little bar with stain, and the tears basically spread the stain up to a certain number, which is the millimeters of the tear production. So 15 and up is normal, below 15 is abnormal, and we had about 12, I believe, last time. But this is not Zayu. This is just a second. I said Zayu and I meant Maiyu. I'm sorry. It's just Zamyla and Maiyu. Alicia, you did the same thing. Anyway, going back to the medical history, just to give everyone a summary. So I know that you've been using medicated shampoo. You've been using also Allegrum, and you've been faced with a lot of licking and biting, right? Every 30 minutes, paws and elbows, and neck and ears. I want to ask you one thing, and I'm going to share pictures, if it's okay with you, some of the pictures with everyone else. Has Maiyu had any testing for Cushing's disease?
No, she has not.
Okay. So I'm going to show everyone else what's happening. And, my heart goes out to you because I see how much scratching there has been. So for everyone else, I'm not sure whether you can see it. I'll zoom in. This kind of almost thickening of the skin, we call it lichenification in medical terms. The thickening is a result of excessive scratching, but sometimes it also is a result of the skin not functioning in simple terms well. Skin is actually the largest organ in the body, and when it doesn't function properly, then it doesn't renew well, and then it starts thickening, and also it starts harboring yeast and bacteria, and it can be uncomfortable. So in this situation, and I know that I could show other pictures, but I'm going to just go back to what we need to do here. Quite often when I see this thickening, it may be a sign that there's Cushing's disease, which is an overproduction of steroid hormones, natural overproduction of steroid hormones. And there is one really simple test that I would highly recommend Zamyla you do, and that is called urine cortisol. And there's about 97% accuracy to rule out Cushing's disease. So if it's negative, then we know that we are not dealing with Cushing's disease. But if it's positive, then you may need to do some other testing. You may need to stimulate the adrenal glands to see whether they're responding normally or not, because positive test doesn't necessarily mean that there is Cushing's disease. Negative test means that there is not, okay? So it's a little challenging, but basically the simplest and the least expensive test is the urine cortisol. And Alicia is writing it down, and she's gonna send you the information. Many veterinary clinics do immediately a whole battery of tests, but you don't need to necessarily do that. You can just do the urine cortisol and see if we are dealing with Cushing's disease. If we are, then there are some other treatments. There is an article on my website that you can just kind of look through. but the thickening of the skin and seeing seeing the ears and the neck and everything else, the paws, makes me feel that we need to take this step. Now, the next thing is to, and so this is the first thing that that we want to do. Um, does she walk regularly? Do you have her on the leash or off the leash?
Yeah, we have both leashed and unleashed walks on harness and just like a rope leash. She doesn't like it when it is wet outside or maybe even threatening to rain. So on those days, she doesn't walk too much. But when it's dry, she really enjoys her walks.
She's a fair weather girl. Where do you live, by the way?
In Vancouver, BC.
Oh, Vancouver. You're from Vancouver. Too much rain for her. Oh my goodness.
We've lived a couple of different places. So we've been in Boston first and then in Toronto. And certainly I feel she actually has had most issues in Vancouver. Maybe
Yeah. You know, the wetness may definitely contribute. Now is she moderately active, or how active is she?
She's a sleepy girl. She likes to relax, but she can also, go on like a 2-hour hike as well when she.
Okay.
Oh.
Here we have actually quite a bit of space, so we need to do the urine cortisol, and I can also recommend holistic vet in Vancouver through Alicia. There are a fee, so we can also make a little bit of a adjustment if necessary. There are a few things that I'd like to talk to you. Diet and kibble. There is no medical doctors who would say that processed food is better than wholesome food. And in the veterinary profession, it still goes on. We have been kind of brainwashed by the pet food industry, and that's the main reason. There's some other reasons that most of you will kind of deduct, but I'm not going to get into the politics of processed food and all that and the business model. But you're feeding salmon and you're feeding sardines. Unfortunately, the sardines, what I've seen, they may contain radioactive strontium, and it's a complicated thing. We have an article on that, but strontium has been released in Fukushima in 2011, I believe it was, and we started seeing increased strontium levels on hair testing in dogs. And strontium is an element that replaces calcium, and when it replaces calcium and dogs eat the sardines with the bones, they get actually higher dose of strontium than if they were eating fish without the bones, right? So there is a whole pathway how the strontium get in the system, and we usually do hair test and see that there is elevated strontium. So you may either stop the sardines, or if you're really curious, you may want to run the hair test, which is a mineral test and toxin test that would give you an idea what her levels of the healthy minerals are and the toxic, including strontium, or harmful. So stop feeding the sardines, and I would probably stop feeding the salmon right now, because you can give her some other omega oils that will be safer and more sustainable. There is this documentary that was just released on Netflix. It's called Seaspiracy. I would recommend everyone to watch it, you guys, because it's really an eye-opening documentary about how seafood is produced and how the whole system is actually rigged. Even the, let's say, dolphin safe tuna and all that, the agencies that approve the dolphin safe tuna actually have been associated with the fisheries and with the fishing industry. It's pretty crazy. The other thing that I'm seeing here, and we still don't know, we have the unknown of the Cushing disease, and I hope this is not the case. But the other thing that I noticed, liver treats are kind of tricky, because if you feed about 10% of the food in liver treats, we may be dealing with something which is called liver toxicity, because there can be excess of vitamin A. And vitamin A is fat soluble, and it may create hypervitaminosis, especially when you give the dried liver. It's quite a bit, right? Like you're giving a lot of liver because it's dehydrated. And there's an article again on liver toxicity, liver tree toxicity. So that's something that you may want to eliminate as well. I would highly recommend you giving either cooked food, which you already do, but stop the kibble and using the recipe maker, which everyone else, there is a recipe maker on our website. If you want to type in recipemaker.petertobias.com, you will see the recipe maker and it'll give you good instructions. The other thing, and so we have a lot of things that we can do, and I'm hoping that this is not Cushing's disease and that Mayu's adrenal glands are healthy. And if they are, then I suspect that she probably was on medication and prednisone before you got her. It looks like she has some signs of it, right? I would put her on the essentials, and essentials, have been. I do recommend them. I formulated them. I sell them, but they have kind of come up from my realization that unless I give my patients essential nutrients, I'm not going to really be able to solve many of the health problems, right? So what do you do in medicine? Ideally, you should get rid of what should not be there, like let's say the liver or the sardines or whatever toxins, and then you should provide the body with all the nutrients. And because soils have been depleted and food has been depleted because we don't really put the compost back to the soil where the food came from. There's mineral depletion, vitamin depletion. We live in industrial environments. The probiotics, the helpful, beneficial bacteria gets depleted. Omega oils are not in food as much. So those four are really beneficial, and they can basically correct many deficiencies. If we want to grow tomatoes, we all know that nutrients need to be available. Otherwise, the tomatoes are not really growing well. We forget that we are the same way. I've been making myself a little bit of a guinea pig as well, and obviously Pax, my dog, and our previous dog, Sky. And the difference between those two is huge. Even though Sky was relatively healthy, he was not put on the essentials until he was about 8 years of age. Pax has been on them since the early age of 8 weeks. And there's a huge difference how they function, how they develop, how the spine energy flow works, how they repair and recover from injuries. So, I'm going to do one thing, because you put attention into writing up the little medical history. You obviously do a lot. We're going to send you a little discount coupon for the essentials, so you can try them, and they're also fully guaranteed. So you can send them back, and we'll give you full refund if for whatever reason you don't like them. But I have a full confidence. That's what I take every day, actually 6 days a week, not every day, and that's what Pax gets as well. But we need to really provide her with the essential nutrients and good food and get her off the kibble, because processed food is never as good as homemade diet. And then see what is left. You're doing everything right otherwise. And I think that the cortisol test will be the deciding factor, how you progress. And again, this advice is for informational purposes only, for educational purposes only. So if you have any questions, talk to your veterinarian, or we'll give you a name for a veterinarian that I know is practicing good holistic medicine as well. Do you have any questions? I wish we could go a little longer. I think that it's going to be a long Facebook Live, but I hope it's okay, everyone.
No, thank you very much. It certainly, it doesn't feel good to be feeding her processed food, but, was recommended in order to try and identify allergies. So definitely looking forward to, trying out whatever works best for her, really.
Yeah, we need to definitely test her for Cushing's disease. That's the first thing. In her case, like, I look at her and I go, wow, this is not. And it's similar to the previous doggy, Piper. You may want to deal with a chiropractor. In Vancouver, we have a lovely chiropractor. Her name is Dr. Lana Patterson, and her husband, Sean Patterson. They are in Fort Langley. That's where Pax goes. And I would highly recommend having things checked on that level as well. So, it's a little bit of a journey, but keep us posted. Let me know. It's just been so nice to see and Maiyu sitting there and you petting her. Yeah, they
Thank you
keep us
so
sane, right? In this crazy time.
much. Absolutely.
Yeah. Give her a hug for me. Okay. Thank you. Bye-bye.
Bye.
Thanks.
Really appreciate you. Bye-bye. Ah,
Okay.
you
Thank you so
guys,
much.
I'm having a hard time to hold tears back sometimes. It's so hard and there's so much misconception. And I wish we could sometimes get together with my other colleagues and share all this together. And it's not as easy, right? The conventional medical system is such that many people are not even comfortable using the holistic methods, because if it comes to push and shove and you go in front of a committee because someone tells you that you've done malpractice, nobody will defend us. And that's one of the things that is problematic. I always told myself that I have to lose the fear of losing my license for the sake of helping. And that's how I've worked for the last 30 years. Now I work online and helping you this way, but it's really tragic. And it starts with you, the dog lovers, the customers who can make the difference, and push the organizations to give you the freedom of choosing and give veterinarians the freedom of choosing how they're going to practice. Unfortunately, in today's world, there is a whole bunch of lobbies who are trying to put the obstacles in and make sure that natural products or natural healing is not as available. And it is sad. I would love to have a conversation with those people who lobby against the holistic medicine system and who lobby for drug companies, because I know that they probably are, most of them are good people. I know that evil and greed exists. We shouldn't be naive, but I think most people are good and they just need to understand a little better. So this is the way of us trying to pitch in a little bit.
Absolutely.
Alicia,
Next.
let's go next.
So we're changing gears a little bit. We've gone from a couple of our smaller attendees up to Moose. So I'm going to admit Moose's human in, Jamie. And Jamie's looking forward to discussing her the beautiful boy named Moose, Saint Bernard, that is over 100 pounds.
Hello.
Hi. Good to see you.
Jamie, hi. Hi, how are you?
I'm good. How are you?
Where are you located?
I am in Duluth, Minnesota.
Minnesota. How is the temperature now? Is it spring?
It is. It's 43 today.
Nice. So it's pretty chilly still, but
It's okay. I'm a winter girl.
And is Moose somewhere around?
He's right here. I'll show you.
Oh my goodness. Oh my goodness. What a sweetie.
Yeah, he's living his best life.
Pax looks like a Saint Bernard in a small size. He does exactly the same thing.
Yep.
So I can see you have a moose behind as well.
Oh, yep.
Behind you.
Yep.
So
and those are all pictures of him up there. So
Moose is 3.5 years old, correct?
Yep.
And when did this whole situation happen? He's got a little patch on his almost like an elbow, in his front elbow area, right?
Yep, he's got that. And then he does have like a little pink on the ear flaps. It's almost like dry spots.
I noticed that. Yeah. I noticed that on the pictures. I will, if it's okay with you, I will share some of the pictures. Is it all right?
Absolutely.
Thank you so much. Once again, I'm going to mention a little caveat that this is for educational purposes only. And I will share the file. Let me just see. Let me just open them all, and I'm getting better, Alicia, with this system, aren't I?
Always.
I am fast.
Jamie,
today.
thank you for sending such beautiful photos. We see the skin conditions as well, but the lovely photos of his adventures. It was great.
Oh, yes.
So I'm going to show you some adventure photos here. This is Moose. Isn't he wonderful? And this is Moose again. Lovely pictures, by the way. You have an knack for photography and background, and yeah, that's great. We share that interest. So do you clean his ears?
I do clean his ears. Probably every couple of months I probably clean them, unless I notice that they are a little dirtier, but he typically has pretty clean ears for a dog with big flappy ears.
Does he scratch them?
It's funny, he doesn't really scratch, but he does shake his head quite a bit, actually, especially like when he gets up from laying down. He'll like really shake his head a lot for a while. But as far as scratching him, he doesn't scratch all that too often.
And we can see that he's got a little bit of missing hair around his mouth. What does he like to chew on? Tell me.
He does have his toys. They're usually, they're over there, mostly stuffed toys. But we wash them like every 2 weeks. Especially when I found out he was allergic to dust mites.
Yes. Now, before we start talking about allergies, I'd like to ask you about this patch. So how long has it been there since he was? So
it started back in October of last year, actually. And I wish I would have sent you the pictures, but on the lower part of the arm there, it was almost like a nickel size, like real red spot, and I thought it was actually the start of a hot spot. And so I treated it for that, but it just got worse and bigger, and it got about as big as what you can see there, and it didn't like expand past where the fur ended. So
does he chew it?
I'm sorry, what's that?
Does he chew in that area?
He would lick at it and chew it a little bit. And then, I started working back in October too. So I started leaving the home. So I thought maybe it was a nervous reaction to him licking it. But I don't know. It just didn't get better until we started to treat it a little bit.
I'm going to ask you a question that may be weird, but what side do you walk him on?
He's kind of a cross grainer. He goes left.
Left and right. Do you have a collar or harness on him?
I use a collar. I do have a harness, one of the harnesses through you. But he hates it. He like runs away from me, and I don't know why.
Like it. Okay.
But I do.
Some dogs just don't like anything on their body, right? Like when they're, you may want to put it on during the day so they get kind of desensitized to a point. But let's go back to everything that we have here. I'm going to go back to that patch. If I see a patch of missing hair only in one area, nowhere else, not on the other side, not anywhere else in the body, then I always look locally. And because he's Saint Bernard, he's a large dog, I wonder, has he had any x-rays for his elbow dysplasia or shoulder?
He has not, actually. He just had his checkup yesterday, and it was something that I was going to address with her just because my first Saint Bernard, I lost to bone cancer, so I get really nervous about the front bones.
Yeah.
So I was going to ask her about doing x-rays on him.
So this is the first thing, and this is very different from the first two dogs, right? We have a situation where there is a patch of missing hair. It's only in one area. I know that we are dealing with large breed dog, and that he hasn't had any x-rays. There may be tension in the muscle area. There can be elbow dysplasia or shoulder dysplasia, even though he may not be limping. There's still potential for some sort of problem there. So this is something that I think that you definitely need to do. Now I'm going to, we'll talk a little bit about cancer prevention and all that too, because I don't want you to worry throughout his whole life about this, because that the worry is unpleasant, right? Like it eats away on us. And I'm sorry to hear about your first dog. So you already have this first first-hand trauma, right? Emotional trauma and loss. So we need to address that too. The funny thing is that I'm noticing that he's got missing hair around the lips, right?
Yeah.
And I would just take it very simply, and it's most likely what it is, the toys, because
Okay.
the plush toys, they're kind of abrasive, and if he is in a habit of chewing it, there may be a reaction to the synthetic material, or it can be just physical reaction due to the abrasion. Because if he chews on it, or if he uses it as a soother, then it may lead to this reaction. So it's a hard one. Like I would, either get something that is made of natural materials, non-abrasive materials, wool, or some sort of cotton fabric that is soft. But even better, I think that for the next month, if you could convince him that the toys are off for a month, then you will see whether the hair will start growing back.
Sure.
And the other thing is, they may start in the ears and the neck and the head. Like if he's a real chewer, he may also have real tightness in the temporal mandibular muscles. That's right here, the chewing muscles. And that may lead to decrease of energy flow and blood flow to that area, and the skin will suffer. So the chewing, we may need to kind of reduce it for some time. And the fact that he has a little bit of flakiness around the ears points to the TMJ or to upper cervical spine. And because he shakes his head, what can dogs do when they have a misalignment? Well, I go to my chiropractor and say my neck is sore or my hands are numbing. Dogs would chew and lick or shake or scratch. They would scratch here, or they would scratch around the neck. So this may be a combination of the toys and maybe some sort of misalignment of his upper cervical. That's what I would do as a first step. Now I'm going to stop sharing now, and we'll go to Moose's file. So I know that he is on hypoallergenic food kibble.
Yeah.
And you're saying that there's possibly starting early kidney disease. Have you done urine sample analysis? Was there, how did they determine that? From a blood test? Did they do urine as well?
Yeah, I think, okay, so there was a reason why we did it, and I can't remember now because it was last year. But for whatever reason, we did a urine sample last year, and it showed had high kidney levels. So they did an ultrasound on him, and everything showed fine through that. So she just said that we'll, just reevaluate come his next appointment, which was yesterday. So we did another urine sample to see if there's any change or any increase or decrease in the values.
Okay. And was it okay? Was it normal or not?
I have not received the results back yet.
Did they tell you to restrict water at least for 12 hours before the urine sample collection?
No.
Okay, so I'll tell you what you need to do. If the urine test, so there's no kidney values in the urine, but there is what we assess is the concentration of the urine.
Yeah.
If the urine is concentrated, and I'll give you the number, it's 1.030 and more. So it's 1030, okay, with the period behind the one.
Yeah.
That would mean that the kidney function is normal. If it's below 1030, you will need to restrict the water for at least 12 hours. I usually do 12 hours and collect the morning urine. And if it's concentrated, then it's great, because sometimes it's just a result of your dog drinking and the concentration is lower.
Yeah.
Then there's blood work that needs to be done. If let's say that we restrict the water for 12 hours, take another sample, and it's still not concentrated enough, then we go for blood sample, and we check two values mainly, well, three: BUN or BUN, which is urine nitrogen, then creatinine, which is another metabolite that is excreted by kidneys, and it may be higher if the kidneys don't function. And then the third one is SDMA, and that's the neuroparameter that we measure. And that's the most specific for kidney disease. SDMA is another metabolite that is actually in the blood and can be measured. So make sure that you do that but there's another caveat here. If you feed kibble, it really stresses the kidneys because it leads to dehydration. The water is absorbed from the body. The kidneys have to recycle the water more because there's not enough water when you feed kibble. They always get dehydrated. It's kind of like, it's given. And as a result, the kidneys are stressed. So the thing that I would recommend, and I know it's sometimes hard, especially with Saint Bernard, it's expensive, but I can see that you love him. And I would highly recommend feeding either cooked or raw food, which is normally hydrated. And it will, and read the article about kidney disease on my blog, because if you address the steps that are there and address the diet and all that, you will hopefully be able to prevent it from happening, hoping that it's not there and that there was some sort of laboratory mistake. And if it's there, then you have the whole, all the steps aligned there, what you can do. But I'm hoping that we are not dealing with kidney disease. Now, I know that he's been getting allergy shots, and I have some allergy tests here and results. Is it okay if I share them with everyone again?
Absolutely. Yep.
Okay, so let me just open them. And share button is here. So the good news is that food came back pretty negative, right? Like they're all and again, I have to emphasize that the allergy tests are kind of, when something comes back positive, it may be the case and that there is truly a reaction, but still you cannot really remove your dog from the outside environment. You cannot make sure that there are no dust mites or something like that, right? So it becomes difficult. So I usually try to convince the immune system by certain steps not to react and treat allergies as an immune system disease. But give you an example, like you're giving the shots, the allergy shots or drops or something like that, right? The immune therapy, correct?
Yep, I am. They're the shots. He gets one every Monday.
I had them too when I had my allergies as a teenager. They didn't really work. They didn't make me less sensitive. And I still question whether it's a therapy that is valid. It is like, give you an example. Someone goes through post-traumatic stress disorder. Let's say they were in a stressful or traumatic situation. And you say, okay, if I expose them to more of the same stress, they're going to be desensitized. Right. And that's what happens actually in case of the immune therapy. I think that it's not addressing the disease of the immune system. If we do have true allergies, it's basically assuming that if we give the allergen more often, that the immune system will settle down. But what will happen if it settles down? It'll settle down because of fatigue. It won't settle down at depletion. It won't settle down because it's healthier.
Gotcha.
If it makes sense.
It does.
Now, I'm going to show to everyone. We have dust mites, severe allergies to dust mites based on the test. But again, like you can't really filter the air and the environment to remove those. So I would not really, at this point, be focusing on allergies, especially if I have very singular local lesion, and knowing that the ears may be related to the jaw and the chewing and the playing with the toys, and the same around the mouth, and the neck shaking may be related to neck misalignment. So those are the first thing that we need to address. I'm hoping that you will be able to find some good chiropractor or acupuncturist, physical therapist. I've been talking for an hour now, mumbling, and solve that, and that you will see the improvements.
Right.
you're also saying that there's some back tension, that he may have tweaked his back from jumping. And that's possible, especially larger dogs. They can slip and slide and cause injuries. Now, I made some notes here. You wanted me to look at your HairQ test of Moose, and I will do that. I would recommend, similar to the previous two doggies, switching to natural diet, give him the essentials, make sure that his body's not missing anything. But honestly, I think that in his situation, I would not really focus on the dust mite reaction as much. I would focus on addressing the physicality of his conditions and see what is left.
Sure. Yep.
That's basically, and so let's go to the hair test. For everyone else, hair testing is one of the methods that I've been using to determine what essential minerals and also harmful elements are in the body. If you take a blood sample, it's only a shot at a time. It's it's a very small time section. But if we use hair, the hair grows out about 1 inch in 4 months. And if we collect it and measure the elements in it, we are able to see what the content of minerals and toxins were or had been in the last 4 months. So I'm just going to share the screen again. If you would like to learn more about HairQ Test, you can go on HairQTest.com website and see what it is all about. These are the results. This is, you can see that Moose Jackson, I like that name. He could be a star, rock star. Yeah. He probably is a rock star in your life, right? Yes, anyway, so Moose is not getting any essentials, and you can see that a lot of these elements are kind of low. Calcium, magnesium. Sometimes it can lead to different muscle challenges and tightness and tendency to cramps, especially with magnesium. We have low iron as well, which is not ideal. We have low cobalt, and cobalt is part of cobalamin, which is methylcobalamin actually, which is vitamin B12. This tells me that there can be some sort of imbalance or weakness in the digestive tract, and supplementing multivitamin, fermented multivitamin that has B12 is the first thing that you need to do. When it comes to iron, right here, I would just sear his food once or twice a week on cast iron pan, which is iron, and that's what I used to do with Sky, who had low levels of iron. And then, calcium, magnesium, and generally, like if you want to make sure that he thrives, then adding plant-based mineral support like green mint would be a good idea. Now, I do suggest the products that I formulated because for years I used to see problems and I wanted to solve them. So I came up with solutions. Some people tell me, well, you should be only giving an advice and you should be suggesting products that you formulate. Well, that would be really sad if I didn't give a solution. And because I couldn't find any optimal ones, I started basically going into formulating them. But again, that is just my way of doing things. You can either take it or leave it. I enjoyed talking to you anyway.
Having products, I just stopped using them because of his allergies. I was trying to eliminate things. So.
Yeah, I understand. So, this is a sign that we have some deficiencies here. When it comes to the toxic metals, we are pretty good. We are still within reference range. That's the white field here. A little bit of arsenic, a little bit of mercury, but nothing terrible. We have normal or low level of strontium. We are still within reference range. We talked about strontium before. So I think that really, honestly, this is one of those situations when we don't look at the biochemistry of the body or the immune system as much, but look at the physicality. So you will need to do some work there. Tell him that you'll give him better choice. Yeah. It's not that you didn't. you know, they're good choice for him, and I know that they were given from with a good intention. But sometimes these toys, they're made in China. We don't know what the fillers are. There can be exposure to all sorts of different toxins and chemicals, and the
Yep.
physical abrasion as well is a problem, or maybe a problem.
Yeah.
Start simple and go deeper, and I hope that the x-rays will be good. Do you have any other questions?
I don't think so. Thank you so much for your time. I do appreciate it.
Oh my goodness. You know, I'm living my dream. I tell you why, because I can still help, and I help more people than I did in the past. And I don't feel burned out. I feel recharged, and I feel this is such pleasure. It's my privilege to see you and talk to you and see your smiley face and see Moose and everyone else. So thank you. Oh my goodness. Everyone, isn't he amazing? Yeah. And try not to, you know, when I'm not sure whether you listened about dissolving the worry, but there's a blog on how to dissolve the worry. You know, meditate on the worry and try to work with it. Don't push it aside. Also take the precautions. I definitely would not put kibble as part of my cancer prevention. It's just not species appropriate food, right? Like it's, I really don't think that you're dealing with true allergies. I may be wrong. You know, everyone can be wrong, but it doesn't really seem like that's what you're dealing with. So that's good news.
Yes, absolutely.
And do maybe some acupuncture or some massage in that area of the shoulder.
Yep.
That's the other thing. I think that there may be tightness of the muscles, but of course you want to check the joint and the bones and everything around. That's a good idea.
Absolutely.
Thanks for your time,
Keep us posted,
Jamie.
okay?
Yeah. Thank you.
Thank you, Jamie.
Thanks.
Bye-bye.
Give him a hug for me, okay?
I will.
Bye.
Bye.
Bye. Oh my goodness, you guys.
Great.
Isn't this absolutely lovely to actually...
It was so nice to see him too.
touch.
Like the photos were good, but then to see him in his home environment, so sweet.
And we have Linda. And
we do.
Wrenn.
We have Linda, and I'll be admitting Linda into the room to chat about Wrenn, her 2-year-old lab retriever cross. And we may admit 2 devices because I think Linda was having some technical challenges. So I'll be admitting a second device. I think that's her sister's device. So just one second.
Let's see.
Okay.
Hi, Linda. You're on the
Hi.
phone. I can see. Oh, you're there. Wonderful. We cannot hear you. I think that you muted, and I'm clicking. Alicia, something is happening with my system. I cannot click
There we
on.
go. Okay, there we go. Okay.
Right. I think that it's just because you are in charge, Alicia, of the system. Is it right?
That's it. Yeah.
Okay.
Linda, hi.
Hi, nice to
Hi,
see
Linda.
you.
Hi.
Hi, Dr. Tobias and Alicia.
Hi.
Where are you?
I'm in Toronto.
You're in Toronto. So we have some Americans, some Canadians. Lovely. And is Wrenn with you?
Yes, Rennie, come here, sweetie. I'll get her a treat. That'll get her going. Rennie.
Okay. In the meantime, while you're getting her, I'm going to share with everyone the medical history, if it's okay with you.
Yeah, please do.
So Wrenn is Lab Golden Cross. Oh, hi, Wrenn. Hi, Rennie. So she likes to play and she likes to be active, right? And all that.
Yeah, she's pretty active.
Yeah. So she's been, she was initially on kibble and he switched her to raw 6 months ago. And then you started her on the essentials right now in March. She has history of skin problems, correct?
Yes, she started off as I fostered her from 7 weeks. She was a future dog guide. And so she wasn't actually my dog at that point. So she had to be fed exactly what they gave her and treated by their vet. And so once I adopted her, I wanted her on raw food. But yeah, she was disqualified for atopic dermatitis, and she had many ear infections and was on Apoquel, many doses of Tylan. But she immediately started getting better, but we just want to see how we can continue to improve that.
So I'm going to share some pictures as well with our
Okay,
community, if it's okay, Linda.
sure.
And thank you. So this is Wrenn, and you can see that she's sitting here scratching her mouth and chin, and here I've seen a lot of pictures. She likes her toys. She's a lab, and labs like toys. And she likes to play and carry toys. She's so cute. Look at her eyes. I have a few questions for you, if it's okay.
Sure.
I made notes. So how much, what does she like to do? How much playtime does she? Oh, you've answered that actually for me. I asked that question and Alicia asked you back, and you answered that she does about 3 times 10 to 15 minutes play sessions a week. What are the play sessions? Can you tell me?
Oh no, that was just, I think she asked if she was playing tug or ball specifically.
Yes, yes.
So yeah, ball, yeah, I mean, I know it's not good, but she's totally obsessed and loves it.
Oh my goodness, I know. She's a lab golden. Like, what do you expect? You can't really change the DNA in her.
There, she's brought her toy to you.
That is so cute. My lab has the same toy. He loves it.
How often does she carry the toys and stuff? Does she carry them? Like, does she always have toys around?
Quite often, yeah. I think she knows she's on screen right now. She's asking for a. Can you hear her?
I think that Alicia, I hope it's okay that I confess that you have a similar doggy, right? That likes to do the same thing.
Yeah, my boy Diesel, and Linda and I have discussed this briefly by email, that I really understand where she's coming from, because he loves having something in his mouth, loves to play. It's in their nature, right? It's
absolutely. Absolutely. Yeah. Thank you, lab and golden breeders. Thank you so much. Well, that's their job. Anyway, you also are concerned a little bit about leash pulling. She pulls on the leash, right?
Yeah, she will pull. She has been on a harness since I adopted her 6 months ago. But before then, there was a certain amount of pulling. We were asked to use Halties or gentle leaders with them. So she's good with that, and I switch. I let her walk on harness, but if she's in her full lab scavenging mode,
that is difficult, right?
Yeah, excited in a new area, then I'll switch her to the gentle leader.
Where does she? Okay, and that's the one on the nose, right?
Yes.
Where does she? Where does she scratch? That's what I wanted to ask.
Oh, well, lately this last few days, she's been scratching a lot on her, oh, look her right now, she's biting.
Biting her back.
She's biting her back, yeah, and she'll scratch in a similar area, yeah.
Yeah, is there missing skin there, or she just bites like that?
No, I've been looking carefully. I will have a lot of hair in her feces, though. There was one time I was just shocked. It came out looking like filth.
Okay. I'm going to go back to, is she still on Apoquel?
No. She hasn't had that.
Is she on any medication right now?
No medication, no.
Okay. You see, for everyone else as well, this is a good example how dogs chew and scratch and eat their hair as a result of that. But nobody is really asking one question: is it physical or is it immune system related, right? Because if I had sore back, well, you've asked this question probably, but we don't, in veterinary medicine, we don't ask this question often enough. If I had sore back, I would touch it, I would massage it, I would go to a massage therapist, chiropractor, or someone like that. And my experience is that a lot of these active dogs that have all these different idiosyncrasies and obsessions, and they just love to be active and busy. But the body has not really, if Wrenn was a wolf, or dog that lived in natural setting, they would do a lot of different things. They would probably not have plastic toys around, and they would not have balls and all that stuff. They would chase the bird, or they would, go after. They would not be bred even for this much obsession. Like border collies are the same way, right? So those breeds, those sporting breeds or those hunting breeds, they quite often suffer consequences of overusing certain parts. Like if you talk to gymnasts or swimmers or cyclists, like they will also suffer from overuse of certain muscles in the body. And I may be wrong, but if Wrenn was my dog, I would embark on a very challenging route of weaning her off from some of the habits and making them more varied. And I'll tell you why. So she's chewing on her back. Yeah. I'll share a little chart, little slide here. Just a second. And I know that this has been discussed at this Facebook Live before, but I will repeat it because you may have not been, and for everyone else. So the body's energy flows from the neck to the rest of the body. And the spine is I call it the main energy flow system. It's like a highway of energy. The body is an electric system, meaning that it conducts the energy and it flows. If it stops flowing due to an injury or some sort of misalignment, then the muscles tighten up, and there can be slip or slide, and you can actually feel it. Sometimes you can run your hand up above the spine and you feel a little different. It's almost like, I always say that healthy spine feels like there's breeze and wind. And when you actually get to the spot where there's stagnation, it feels really dense, and it's different if you train yourself to do that. Dogs chew in the areas that are tight. And because they're kind of, as I said, they're not really designed for this sudden start and breaking. It can take just a few slips and slides with the 10-15 minute ball throwing. And one time she slips and slides and it'll misalign and injure her lumbar vertebra. If you go to an average veterinarian, we have not been trained in assessing the spinal alignment. They will say everything is fine with the spine. But if you go to someone who is trained for detecting these subtle changes and shifts, they will determine that there is a misalignment. So the first thing that you may want to do is to go to see someone, chiropractor, physical therapist, acupuncturist, who will be able to deal with that area. I sometimes run my hand along Pax's spine, and I pay attention to it. And if I see that there is a misalignment, it's almost like my hand goes nice and straight, and then suddenly it just kind of like, it derails. And it, my chiropractor told me that technique. And it's so weird because sometimes it goes to the right, sometimes it goes to the left, and it can be very subtle misalignment. And my chiropractor and I, we kind of have been working together. So I'm able to adjust the spine and see that it actually aligns again. But if these misalignments last for 2 years and she's getting into that, she's grown up dog now, it may stay there and she will not be able to do anything else than chew and scratch. So that's the first thing that you may want to do. There's also homeopathic, and again, this is for educational purposes only. There's also a homeopathic remedy that I would recommend for the lumbar area, and it's called phosphoric acid 1M. And I would give 1 dose. Alicia will send you the information about that and put it in a comment, 1 dose. And I would give it once a week for the next month. It sometimes helps to release the spasm in the lumbar area. And you may be able to detect the spasm by running your thumbs and pushing quite hard in the dips along the vertebrae. And suddenly dogs sometimes look back, and that is a sign that there's a little bit of discomfort, or they twitch, or the skin twitches. That all may be a sign that there is a little bit of discomfort, or the muscles along the side of the lumbar area can be bulging a little bit. I've seen that a lot in labs and golden retrievers. Now, going back to her I loved seeing the images that you send me, because I go, oh, this should be easy. You have a dog that is obsessed with toys, and every time, I saw pictures, either her scratching on the chin or holding a toy.
Mm-hmm.
And there may be the same thing that we kind of discussed with Moose's mom. There can be a reaction, physical reaction to the synthetic material, maybe some of the chemicals in the toys, and maybe too much chewing, right? So if she scratches around her mouth and lips and all that, we are up to a very difficult task of convincing her, or trying to kind of wean her off the toys. And that is not easy. Alicia and I, we had a few conversations about Diesel, but he doesn't scratch his mouth. He's lucky. He's a little, he doesn't have the same challenge. But I don't really like seeing dogs being obsessed with toys. And then it comes to us, because we see them, we can see that they are having fun. It is super hard for us to say, okay, time out, or do something else. I think that they just like to work. So let's say if I had a dog like Wrenn, what I would try to do, and this is take it or leave it, like I'm just sincerely suggesting what I think would work. I would start taking the toys away gradually, and do maybe like an hour session in the morning, an hour session in the evening, where the toys are allowed. Otherwise, they go in the bin. If you see that Wrenn is restless, then there are two things to do. One would be to give her some other work to do, do training, teach her different tricks that would be low impact. So I don't know, teach her the names of the toys, or teach her to weave in between the table legs, or do whatever else. Pax likes to put his toys in the basket, and he gets treats. And I teach him the names of the toys. If she is, and if you don't want to train her at that time, or obviously you can't train her the whole day and give her jobs, then you may want to put her on the leash and give her time out. That would mean putting the leash on the harness and winding it down around your foot, maybe leaving 3-4 feet, and teach her to settle down, right? It's so funny. I have a friend or a couple of friends who have a dog, and the dog barks with them incessantly, and he wants them to throw the ball and all that stuff. And whenever I take him, he doesn't do that. He's happy. He sniffs around, he plays with Pax, and he's absolutely fine. So they're conditioned. We sometimes feel that it is actually suffering for them when they're stopped from what they love to do, and they seem to be relieved. Pax got into the habit of barking because we have deer around, and at night he actually hears them, and he would run around the whole house and bark, and he would irritate me. And yesterday what I did, I put him on the leash, and I tied the leash to a table leg, and he relaxed, and he was so relieved. I was so surprised. I was thinking that he really loves to do that, and that it would be a stress. He was relieved because I told him, it's okay, you don't need to do your job. And that's the funny part, right?
Yeah. Yes, that's interesting. Yeah.
And sometimes we are sensitized to, sorry, I'll just finish and then I'll let you ask questions. Sometimes we are sensitized to our dog's needs to the point where we just can't stand the discomfort within us that we don't do what they want us to do. It is such an emotional, if you're a giver and if you're an empath, you're going to have much more difficult time to actually tell Wrenn, hey, time out. But they are fine, they adjust after a while, but they may have some withdrawal symptoms. maybe Alicia and I will make a date, and I'll make a date with Diesel and see whether I'd be able to just kind of like for one day to change his routine, right? Alicia, I hope it's okay that I'm using you as an example here.
It is perfectly okay.
Yeah, thank you.
Yeah.
So do you have any questions? How can we, Linda, what can we do here?
Well, I mean, you feel this itching could be related to spine, and I will get that checked out. It was interesting when you said about feeling the spine. About 2 days ago, I just happened to be petting her, and I felt there was a spot on like a sort of mid back that was hot.
Yeah.
And I thought, oh, you've been lying against a radiator, but they're not on right now. And it was really hot. And I thought, oh, that's just like, you know, if we have an injury, we'll feel heat.
Yeah. You know, another little note, if you have a block in the middle of the spine, let's say somewhere mid back, then all the, you know, sometimes I see dogs that have change in the texture and sheen of the hair beyond that point. It's almost like the energy is cut off. It's like something pinches the spine, and everything beyond that point will actually not do as well. Or sometimes if we have this impingement later on, if dogs get middle-aged and older, they would have organ disease or insufficiency as a result of these blockages, because every point actually relates to different organs. And so it's good that you observed it. You know, the back, definitely, I would check that. Sometimes there's another element. It can be related to digestive tract. The lumbar area is directly related to the gut. But in her case, she's a young dog. She's on good diet. You know, she's now getting good supplements. We'll see how things develop and evolve. But I really think that the mouth is more of a contact reaction to the toys, and maybe a little of TMJ, temporal mandibular joint issue, tightness of the muscles. But the back is most likely related to her ball chasing. You know what you can do with the ball if she really loves to go to the park and chase it? Teach her to sit and wait. You throw it, and then she actually goes for it, but a little less intensely.
Yeah. Okay.
Or hide the, you know, if there is a bench, you initially tie her to the bench, you hide the ball somewhere, and she searches for it. It's a ball game too, but it's more tracking. It's much more natural movement, and it's not high impact.
Okay, that's a good idea.
Yeah, I would definitely try not to go the medical route, because you know that some of these drugs are really strong. They suppress the immune system. The side effects of medication like Apoquel are really harsh. I'm just going to, for everyone else, I will read them. I'm just going through my notes here. In the meantime, do you have any other questions?
Well, it seems that the best protein for her at the moment is pork. She seems to get more itchy if I try turkey, duck. Beef and lamb didn't work at all. She actually got more digestive problems with it, like the stool was not good. So I'm wondering, you know I should be giving her variety.
Mm-hmm. Do you give raw or cooked?
Raw.
Is she a chili dog, or does she get overheated?
Seems to be just about right. I mean, she won't wear a coat in the very cold weather, so I don't think she's very cold. Yeah, she seems to be. Okay.
You know, now when you're saying digestive issues, does she get diarrhea sometimes?
Very rarely since she's been on the good diet.
Okay. But how often would she, you say rarely, like how often would it be?
Oh, maybe once every 2 months.
Okay.
She might have a bit
now,
of diarrhea.
The fact that she does get itchy after certain foods makes me feel that the lumbar area, even though there may be an injury, may be also related to a little bit of gut imbalance, okay? in this case, you know what I would try? I would try something simple. I would actually add digestive enzymes to her food, and I would actually try to cook the proteins, even the ones that in the past she was a little more sensitive. You can also try what protein she does better on, and obviously try to feed more of that. Sky was better with chicken and poultry. Pax is better, not as good on poultry and chicken. He gets overheated. He doesn't get diarrhea, but he starts panting when I feed it too often. So try that and cook it and add digestive enzymes. I use Udos or Flora. Is it Udos or Flora? Digestive enzymes. I think it's Udos. It's a good digestive enzyme formula.
Okay, I actually was giving her a digestive enzyme. It was called Canine Sunday. It was something I have a very good store in Toronto.
Okay.
Wholesome Canine that gives excellent advice and you can trust any product that they sell there. And she seemed like so receptive to that, but it seems to have stopped working.
How do you feel about the change in the play routine? Is it too hard to imagine?
No, not at all. Because she was, her first year and a half of life was to be training to be a service dog, and we had to be fairly disciplined with them.
Yes.
And she really wasn't supposed to have balls, and because they get disqualified for being obsessed with balls, or they send them to border services.
Oh my goodness. Oh, my parents, they were very old fashioned. My dad decided that when I misbehaved, I was like 5 or 6, that he told me that he would send me to an orphanage. He never said that he would send me to the border services, but the orphanage was actually very nearby border, the German border, about 3 or 4 kilometers, 2 miles. So funny. I've never heard that, border services. She's lucky to be with you. And I hope that things will work out. Please stay in touch, because we'd like to stay in touch with you and see how things go. Once again, I want to emphasize that this advice was given only for educational purposes, and that you need to work with your local veterinary team and animal care team. I hope you'll find a good chiropractor. In Toronto, we have Dr. Who do we have there, Alicia? We have
Dr. Burgess is there. I'm not sure if she does chiro.
Dr. Benson, Carolyn Benson as well is there.
Yeah.
I would highly recommend you maybe connecting with them. I think that they do some chiropractic work, and it's.
Sorry, I was going to say, before we hop off, I believe, Linda, you recently purchased Soul Food, Green Min, Feel Good Omega, and LiverTune, which was just delivered maybe within the last week. One question I think that you had, and correct me if it's already been discussed, but based on her recently getting these supplements, Dr. Tobias, do you have a preference as to how they're added into Wrenn's diet now that you've had a chat about her challenges?
In her situation, and this is, I would do the liver cleanse once every 6 months, but I probably wouldn't be starting with that now. Unfortunately, the one that I think is the most important right now, and that's gut sense to finely tune her digestion, he didn't get. But what I'm going to ask Alicia to send you a little discount coupon, so it's a little easier on your budget. And just because you put the energy and time into putting this all together and looking after Wrenn so well, we'll just send you a little discount coupon, and you'll be able to get that. Any other questions before we go?
No, I think that's it. Thank you so much for your time.
You're welcome.
I do enjoy reading all your publications, and so it's really nice to meet you in person. And thanks for the time for Wrenn. It's
thank you,
benefit.
and that's really lovely. And likewise, it's been a pleasure. And everyone else, and also people who are watching recording, we are launching our podcast channel. It's called Not Just About Dogs tomorrow, just for Easter holiday. Canada is in a lockdown stage, and so there's something to do. You can garden, or you can clean, and you can listen to helping your how to help your dogs. But the reason why it's called Not Just About Dogs is simple. I think that I don't like to limit myself just to dogs, because if we are healthy, our dogs are healthy. If the nature is healthy and the environment, we are also healthier. So we're kind of, I'm going to talk about many different things, about prevention and about different aspects of healing and what we discuss here as well. So yeah, if you like it, share it, rate it, and if you don't like it, let us know, and be patient with me. I'm starting.
Thanks so much for your time, Linda.
Excellent.
And thank you, Dr. Tobias.
Okay.
Thank
Bye
you.
now.
Alicia, do we have any questions, or do we have any questions?
Well, we're at 2:43 Pacific Standard Time, so I think we're good for questions now. Okay. I know that our team will definitely get back to all of the community that have posted in the comments section. I'm sorry that we can't take your live questions today, but hopefully everyone's gained a little knowledge after listening and watching the chat between Dr. Tobias and our 4 dog lovers today.
Thank you. Thank you, Alicia. Thank you, Paula, everyone in the background as well.
Bye now.
Thank you.
Take care.
Bye. Bye-bye.